Nearly 300 years ago, the city of Natchez was born. Woven into its rich story are roots that have shaped this deep South town into what it is today. A city of strength, determination, and character. Known as the birthplace of Mississippi, Natchez attracts tourists from around the world. People choose to live here not only for quality of life, but because of the drive for strong economic development to support new industries that are calling this charming place home. But with all this new growth, healthcare must remain a top priority to support the needs of residents in a reform-changing environment. For more than 50 years, Natchez Regional Medical Center has cared for the very people who have made this town what it is. Its doctors and staff have achieved noteworthy milestones with the latest science and technological advancements. Advancements the Miss Lou area depends on. Just as sure as the Mississippi River flows through the veins of this region and its people, so does our hospital, which serves 90,000 citizens in 4 Mississippi counties and 2 Louisiana parishes. With an annual payroll of $14.5 million, the hospital employs 414 employees and 43 active physicians on the medical staff. But more funds, more staff, more capital are needed to ensure the hospital continues a positive future here. Generations have relied on Natchez Regional Medical Center, a place where trusted neighbors provide quality care. To protect that experience for future generations, our hospital needs a partner that understands our people and communities and can provide much-needed access to revenue and resources that will help us attract the best doctors and staff and strengthen the hospital's position as a key economic driver for the region. But to understand where we're going, it's important to know where we've been. The legacy of Natchez Regional Medical Center began on October 7, 1955. This was a time period when the economy in Natchez was booming from new industries such as Armstrong Tire and Rubber, Bluebell Manufacturing, Johns Manville, and International Paper Company. A rapid increase in population resulted in a demand for health care. A growing number of new physicians moved to the area, and the community responded by appearing before the Board of Supervisors, requesting the board adopt a resolution to build a county-owned hospital. On April 16, 1960, a dedication ceremony was held on the front grounds of the hospital, with an estimated 10,000 citizens touring the gleaming facility, which was initially named Jefferson Davis Memorial Hospital. Memorable words were spoken in the hospital's dedication address by Congressman John Bell Williams. This hospital is not being built just for today alone, but rather to serve generations who are to come.
I was around when the hospital was first conceived, was able to follow it. There was a lot of excitement in Natchez because the other hospitals that were here were beginning to deteriorate and did not have the medical facilities that we were looking forward for this one to have. So I think Natchez was very excited about it, and it was extremely exciting times, everybody waiting for the grand opening to see what actually Jefferson Davis Hospital was going to look like. But as we go forward, and of course that's going to be up to the Board of Supervisors how far we would go, but I think it's probably time for the hospital to be sold. And I think there's excitement in the community, and I think the community is ready, and we just hope that the future is going to be as bright as we think it's going to be.
Between 1960 and the turn of the century, other significant highlights included installation of the first image intensifiers in the state, resulting in a much better diagnostic detail. Establishment of the Pink Ladies, the hospital's volunteer program that stands strong today with 46 active volunteers who play a vital role in the hospital. A series of hospital renovations resulting in millions of dollars invested in expanding and improving operation rooms, labor and delivery rooms, opening of a women's center, additional hospital floor added, adding an intensive care and coronary care unit, a new emergency services area, imaging department, and medical records. During this same time period, other significant milestones made were: our first laparoscopic surgeries were performed. We changed the hospital's name from Jefferson Davis Memorial Hospital to Natchez Regional Medical Center to reflect the hospital's status as a regional medical center. And our 30,000th baby was delivered.
I grew up in Natchez, and I really wanted to get into a small town atmosphere where I could have a bigger impact on my patients' lives. And I chose to move back to Natchez. I've been here 17 years, and I've got a lot of good friends and take care of a lot of my friends' family, and just enjoy taking care of people and playing an important part of their life. And it certainly have a lot of responsibility with it too, and I certainly don't take that lightly. I think it's important that Natchez Regional is maintained in the local environment and is an important hospital where people can get their care that they need.
Natchez Regional Medical Center has also celebrated many other firsts, including the first intensive coronary care unit in the state of Mississippi, named after Dr. Clifford Tillman. The first and only Level 2 neonatal intensive care unit in Natchez, which means the hospital has the expertise and equipment to care for and stabilize high-risk newborns. The first and only inpatient senior behavioral health unit in Natchez. The first and only cardiac rehab in Natchez. The first hospital in Natchez to install picture archiving communications systems, PACS, allowing physicians to view patients' images remotely, increasing the speed of diagnosis, which allows treatment to commence sooner. And we were also the first hospital in Natchez offering digital mammography and bone density. Today, Natchez Regional continues to be known as a full-service hospital that meets the medical needs of our community. From outpatient imaging to expert heart care, the community has quick access to the care they need. Generations of families have been cared for by Natchez Regional Medical Center. But one particular family, the Giddons, has especially been touched by the hospital.
I'm Jenna Giddon. I'm a new family nurse practitioner at Natchez Medical Foundation. I'm married into the Giddon family, and Natchez Regional is just a big part of who we are.
The future of Natchez Regional Medical Center is vital to my friends, my family, my extended family, my grandchildren. I want to grow up here, and I want them to have good access to health care too.
Natchez Regional is a big part of my family's lives. It's been for a really long time. We have people that work here. We've had people that have been born here, and it's important to us, and its growth is something that we look forward to.
Having a nice hospital with great facilities like this are very important for myself to keep my livelihood well, and for my patients, because they're seeking this kind of technology. If you don't have the technology, then the patient, they drive healthcare. They go where they can get this kind of technology. So it's very important to stay current and up to date, like we're doing here with the Da Vinci system.
Having that high level of care this close to, our community is pretty beneficial.
And if we want our economy to grow around here, you can't get people to move into an area with no health care. It's like trying to get people to move into an area where they can't get an education. They're not going to do it, So it's good health care is paramount to growth.
The future of healthcare is still uncertain in many aspects. What is certain is smaller, standalone community hospitals will not likely survive 10 years down the road without a partnership that will allow greater access to revenue for expanding quality healthcare services.
But the Affordable Care Act is providing a different kind of scenario for healthcare. And therefore, as Natchez Regional presently stands, it cannot stand alone. So it's important to us that we seek out partners. New doctors are learning on modern equipment, digital, all kinds of things that our hospital have some of it, but in order to recruit the doctors that we need for this community, all of these things together say that we need to do something different. So we need to partner with somebody to reorganize, but we want our employees to know that everything is going to be fine. We're going to do everything in our power to protect them.
It is estimated that the number of people leaving the local region for healthcare services is between 30 and 50%. A new partnership will help Natchez Regional expand services, minimizing the need for people to travel elsewhere. Other benefits of a partnership with Natchez Regional will include financial stability, an increase of 40 to 50 physicians, creation of a real regional healthcare hub for Adams, Franklin, Jefferson, and Wilkinson counties, and Concordia and Catahoula parishes, and creation of approximately 1,000 new jobs.
I recognize that healthcare in this country, the dynamics are changing tremendously. And according to the experts, it would be wise for the county to sell Natchez Regional Medical Center. I predict that there's going to be a great benefit for the future of Adams County in terms of healthcare. That will have a domino effect economically for this community. Future industry, future businesses will take a look at that and say, hey, look at this tremendous healthcare facility in this community. We need to invest in this community. We need to select Adams County Natchez as the place to bring our company.
The Adams County, the surrounding counties, they should be coming to Natchez for their health care. They should not be migrating out. And given the right circumstances, given the right practitioners, given the right doctors, people in the surrounding area will come to Natchez for that health care services if we can put all of those pieces together. You know, when you start looking at our recruitment efforts for business and industry, you know, within the top 3 or 4 questions is how's your medical community, how are your hospitals, how's your healthcare system, what does it look like, and it's good to be able to say that we have a solid healthcare system, and it's important to be able to demonstrate that going forward and in the future.
Now imagine the legacy continuing and breaking ground for a new hospital that stands tall in our community, bringing to fruition Congressman Williams' words from the hospital's opening day in 1960, for generations who are to come.
Imagine.
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 Imagine the possibilities.
Invest.
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 Invest in our hospital.
Enrich.
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 Enrich our community.
Imagine being a part of a brand new hospital that has the potential of doubling the number of doctors, bringing more jobs, more growth, being a part of the good news. Make Natchez Regional Medical Center thrive for generations who are to come.